Welcome to another episode from the Veterinary Research Channel. Today, we will be discussing concurrent liver issues in dogs that have gallbladder mucoceles. Gallbladder mucocele is a significant and increasingly recognized condition affecting the biliary tract in dogs. It is characterized by the accumulation of thickened, immobile mucus and bile within the gallbladder. Histologically, the condition is marked by an overgrowth of the gallbladder mucosa, which forms cystic spaces filled with mucus and papillary structures projecting into the gallbladder lumen. The exact cause of gallbladder mucoceles remains unclear. Currently, the primary treatment for dogs with gallbladder mucocele is surgical removal of the gallbladder. Gallbladder mucocele is associated with several complications, including gallbladder rupture and death, obstruction of the extrahepatic biliary duct, bacterial infection, inflammation of the gallbladder, coagulation problems, and systemic inflammatory response syndrome. While many studies have looked into how some of these issues affect how well dogs with gallbladder mucoceles do after gallbladder removal, concurrent liver problems in dogs with gallbladder mucoceles have not been as well described. A prior study reported liver biopsies in dogs with gallbladder mucoceles often showed portal inflammation, portal fibrosis, and bile duct hyperplasia. Furthermore, no studies assessing long or short-term prognosis in dogs with gallbladder mucoceles have investigated the relationship between liver abnormalities seen under a microscope and survival. It has been noted that some dogs who undergo surgery to remove their gallbladder for treatment of gallbladder mucocele sometimes die from ongoing liver and biliary tract problems. The neutrophil-to-lymphocyte ratio in the blood has been evaluated as a marker for inflammatory diseases in dogs, including brain and spinal cord inflammation of unknown cause, chronic enteropathy, systemic inflammatory response syndrome, pneumonia, acute pancreatitis, and septic peritonitis. It would be helpful to have a non-invasive marker to predict inflammatory liver lesions if these lesions were associated with worse outcomes in dogs with gallbladder mucocele. A recent study in the Journal of Veterinary Internal Medicine explored the prevalence, predictors, and impact on long-term outcome of concurrent liver issues in dogs with gallbladder mucoceles. The objectives of this study were to determine how common liver abnormalities are in a large group of dogs with gallbladder mucoceles, evaluate the relationship between liver abnormalities and long-term outcomes in dogs with gallbladder mucoceles, and determine if the neutrophil-to-lymphocyte ratio differs in dogs with gallbladder mucoceles with and without inflammatory liver lesions. It was hypothesized that liver abnormalities would be common in dogs with gallbladder mucoceles and that inflammation and fibrosis would be associated with shorter survival. It was also expected that the neutrophil-to-lymphocyte ratio would be higher in dogs with gallbladder mucoceles and inflammatory liver lesions compared to dogs without inflammatory liver disease. The study was performed by reviewing medical records from Michigan State University, Veterinary Medical Center, and Ozark Veterinary Specialty Care. Researchers searched for the terms gallbladder mucocele and cholecystectomy from January 1, 2016 to December 31, 2020. To be included in the study, dogs had to have undergone a cholecystectomy for a histologically confirmed gallbladder mucocele, and archived gallbladder and liver tissue had to be available for evaluation. Dogs with incomplete medical records or significant concurrent disease, such as cancer, were excluded. Information such as age, breed, sex, weight, clinical and laboratory data, presence or absence of gallbladder rupture, and outcome were recorded. If outcome data was not available in the medical record, referring veterinarians were contacted to obtain date and reason for euthanasia or death, if known. Outcome data was recorded as alive or dead at 1, 3, and 12 months post-cholecystectomy. The minimum requirement to be included was that outcome data was available for at least 1 month post-cholecystectomy. The gallbladder and liver tissue samples were evaluated by a pathologist and a pathologist in training who were unaware of the case data and outcome. The diagnosis of gallbladder mucocele was confirmed based on cystic mucinous hyperplasia of the gallbladder wall and abundant mucus in the gallbladder lumen. Dogs with cystic mucinous hyperplasia, but without mucus accumulation, were excluded from the study. The hepatic tissue was evaluated for biliary hyperplasia, centrilobular hepatitis, cholestasis, cholangitis, cholangiohepatitis, necrosis, portal inflammation, and vacuolar hepatopathy. Applicable criteria from the World Small Animal Veterinary Association were used. The Medivir histopathology scoring system was used to evaluate fibrosis and necroinflammatory activity. Masson's trichrome staining was performed to optimize scoring of fibrosis, and rhodonine staining was performed for grading of copper. Finally, the neutrophil-to-lymphocyte ratio was calculated by dividing the segmented neutrophil count by the lymphocyte count. Descriptive statistics were calculated, and variables were assessed for normality. Categorical and ordinal hepatic histological variables were assessed in relation to outcome at 1, 3, and 12 months post-cholecystectomy. The Mann-Whitney test was performed to determine if the neutrophil-to-lymphocyte ratio differed between dogs with and without hepatic necrosis, cholangitis, cholangiohepatitis, portal inflammation, and centrilobular hepatitis. The search of medical records yielded 101 cases. Liver tissue was unavailable in 1 case. 30 dogs had cystic mucinous hyperplasia, but lacked mucus accumulation, and 16 dogs had significant concurrent disease. Thus, they were excluded from the study. No outcome data could be obtained for 2 dogs. Ultimately, 52 dogs were included in the study. Of the dogs included, 15 were castrated males, 2 were intact males, 34 were spayed females, and 1 was an intact female. The median age was 11 years, and breeds included mixed breed, Shetland Sheepdog, Beagle, Labrador Retriever, West Highland White Terrier, Chihuahua, Jack Russell Terrier, Miniature Dachshund, Shih Tzu, Yorkshire Terrier, and others. The median body weight was 8.7 kilograms. 7 out of 43 dogs with a complete blood count available had banned neutrophils present. All dogs received antibiotics around the time of surgery. 38 dogs were administered ampicillin sulbactam alone, 6 dogs were administered enrofloxacin alone, and 2 dogs were administered cefazolin alone. Gallbladder rupture was noted during surgery in 7 out of 52 dogs. Bile culture was performed in 50 out of 52 dogs, and no growth was reported in 44 out of 50 dogs. 3 dogs had growth of Enterococcus species, and 1 dog each had growth of Klebsiella species, Escherichia coli, and Streptococcus species. 51 out of 52 dogs had at least 1 hepatic histologic abnormality. The most common fibrosis score was F2, followed by F0 and F3. Portal inflammation was common and mild in all cases. In 6 out of 25 cases, portal inflammation was solely neutrophilic, and in 19 out of 25 cases, it was mixed neutrophilic and lymphoplasmacytic. 14 out of 22 dogs with cholestasis had both intrahepatic and extrahepatic cholestasis, whereas 6 had extrahepatic alone and 2 had intrahepatic cholestasis alone. Vacuolar hepatopathy was observed in 22 out of 52 dogs. The majority of dogs had an interface hepatitis score of 0. The majority of dogs had a lobular necrosis score of 0. 13 dogs had cholangitis or cholangiohepatitis. All but 1 case had neutrophilic inflammation. The most common copper rhodonine stain score was 1. All dogs had outcome data available at the 1-month time point. 10 dogs died in the 12-month period following surgery. Cause of death noted for 6 dogs was listed as ongoing liver issues for 2 dogs and unknown for 4 dogs. An additional dog was deceased by 3 months, and the cause of death was unknown. The remaining 3 dogs died between 3 and 12 months post-cholecystectomy. Cause of death was unknown for 2 dogs and listed as general decline for the 3rd dog. Post-cholecystectomy biochemistry results were available for 4 dogs who were deceased by 12 months. All 4 dogs had persistent elevations in alkaline phosphatase, and 3 dogs had persistent elevations in alanine transferase. The proportions of dogs with all categorical histologic abnormalities alive versus deceased at 1, 3, and 12 months post-cholecystectomy were not different. However, the proportions of dogs alive versus deceased differed depending on the portal fibrosis score at 1, 3, and 12 months post-cholecystectomy. The neutrophil-to-lymphocyte ratio was higher in dogs with hepatic necrosis and cholangitis or cholangiohepatitis when compared to dogs without these lesions. The neutrophil-to-lymphocyte ratio was not different between dogs with and without portal inflammation or centrilobular hepatitis. This study found that liver abnormalities were common in dogs with gallbladder mucoceles. How long a dog lived was related to fibrosis scores at all time points post-cholecystectomy. It is possible that chronic disease reduces longevity in dogs with gallbladder mucoceles. It was also found that dogs with gallbladder mucoceles, hepatic necrosis, and cholangitis or cholangiohepatitis had higher neutrophil-to-lymphocyte ratios compared to dogs without these lesions. Thus, the neutrophil-to-lymphocyte ratio has the potential to serve as a marker to predict the presence of these lesions in dogs with gallbladder mucoceles. The most common liver abnormalities in dogs with gallbladder mucoceles included hepatic fibrosis, biliary hyperplasia, portal inflammation, cholestasis, and vacuolar hepatopathy. Less common abnormalities included centrilobular hepatitis, hepatic necrosis, and cholangitis or cholangiohepatitis. Other studies have also reported that a high proportion of dogs with gallbladder mucoceles have liver abnormalities. One previous study found that the most common liver abnormalities were cholangiohepatitis, biliary hyperplasia, and cholestasis. Another study found that liver abnormalities included portal inflammation, hepatic fibrosis, biliary hyperplasia, and vacuolar hepatopathy. In the current study, hepatic fibrosis was the most common abnormality observed. The researchers evaluated hepatic fibrosis with Masson's trichrome stain, which may have increased their ability to detect it. Hepatic fibrosis is a response to chronic liver injury and inflammation. It is possible that the dogs in this study were affected by gallbladder mucoceles for a longer period of time before cholecystectomy. The researchers hypothesized that dogs with hepatitis would be more likely to be deceased at specific time points post-cholecystectomy when compared to dogs without lesions. But the proportions of dogs alive versus deceased did not differ in dogs with hepatitis or portal inflammation. It is possible that cholecystectomy helps to resolve ongoing cholangitis or cholangiohepatitis in dogs with gallbladder mucoceles. It was found that worsening fibrosis scores may have increased the likelihood that a dog with gallbladder mucocele will be deceased post-cholecystectomy. Hepatic fibrosis can occur as a consequence of canine chronic hepatitis, lobular dissecting hepatitis, extrahepatic bile duct obstruction, cholangitis, ductal plate abnormalities, right-sided heart disease, and cranial vena cava obstruction. In dogs with gallbladder mucoceles, the most likely causes of fibrosis include chronic extrahepatic bile duct obstruction or cholangitis. The finding that hepatic fibrosis may impact outcomes suggests that early cholecystectomy in cases of gallbladder mucocele may lead to improved outcomes, depending on how long it took for fibrosis to develop. Recent data suggests that outcomes are considerably improved in dogs undergoing cholecystectomy for treatment of gallbladder disease electively compared to non-electively. However, due to the small number of dogs in the study, as well as incomplete information regarding cause of euthanasia or death, it cannot be concluded that fibrosis is a poor prognostic indicator in cases of gallbladder mucocele. Dogs with gallbladder mucoceles may suffer from a variety of complications and concurrent disorders, all of which may have contributed to death. The researchers evaluated the neutrophil-to-lymphocyte ratio in relation to selected lesions of the liver to examine its utility as a biomarker. It was thought that would be useful if the neutrophil-to-lymphocyte ratio predicted lesions that may impact long-term outcome. Dogs with hepatic necrosis and cholangitis or cholangiohepatitis had increased neutrophil-to-lymphocyte ratios compared to dogs without those lesions. However, no change in the proportion of dogs alive versus deceased was found in dogs with these lesions post-cholecystectomy. The neutrophil-to-lymphocyte ratio could be increased in dogs with acute pancreatitis, chronic enteropathy, and critical illness. Thus, its utility to predict certain lesions in dogs with comorbidities is limited and no cause and effect relationship can be determined. There were several limitations to this study. The data was collected retrospectively from multiple institutions over several years, in which approaches to treatment for gallbladder mucoceles pre- and post-cholecystectomy may have differed. Furthermore, the effect of any postoperative treatment regimens was not able to be considered when evaluating outcome. Additionally, the sample size was low and sufficient follow-up information was not available to perform survival analysis. The reasons for euthanasia or death were not known in the majority of cases, and therefore may have been unrelated to ongoing liver disease. Finally, inter-observer agreement is poor when assessing necroinflammatory activity in the liver. In conclusion, liver abnormalities are common in dogs with gallbladder mucoceles, and advanced fibrosis might be associated with poorer outcomes. These findings might support early surgical intervention in dogs with gallbladder mucoceles. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and, as always, keep those minds inspired, hearts light, and tails wagging.